Hi, and welcome to the Toilet Paper Diaries. Today, it's dedicated to sharing with you the COVID-19 vaccine survival guide. Yes, you must watch this. This is the Toilet Paper Diaries.
Hey, Dave. So great to see you. I am super excited about this episode. We have been doing a lot of research, and I think what we're going to be sharing with everyone, it's going to be super interesting about the COVID vaccine that has been so incredibly controversial.
Well, controversial sounds ridiculous because at the end of the day, it's meant to save lives. I wanted to ask you, Ernesto, which arm did you get your vaccine in?
I got
Which ones?
the left arm.
In the
You?
left. In the right, because I sat down like this, and the lady was on that side, and she just got a big carving knife and started stabbing my arm, and then I blacked out, and I woke up, and I was fine, kind of.
That's cool. I was afraid that that my arm was going to be in pain or whatever. So I said, at least I could work for it because I'm right-handed. So that's why I prefer on the left.
I felt very little. It was fine. It was actually no going along and getting what was such an important piece of medicine, considering the fear that we've been in for over a year. It was a pleasure for that little tiny little nip in my arm twice was well worth the experience, considering the fear that the whole world's been under for the last 12 months.
I was thrilled actually to go for the vaccination. I mean, I was treating it like if it was a documentary. I made some videos and stuff, which you can see right now on the screen, and it was an experience. But anyway, today it's a very important episode for everybody. So please make sure to share this episode. Please make sure to comment on this episode and give us a like so that YouTube could help us also spread this message, because the information that we're going to be sharing with you, it's hard to find. There's a ton of videos about all what we're going to be talking about, but they're confusing and they are, they're not easy to figure out, well, what's what. So Dave and I have watched a ton of videos, have read a ton of articles, and have really been educating ourselves in a survival guide for the COVID-19 vaccine.
Absolutely. And so with this, we'll share with you a number of conclusions that we've got from many different sources. It is definitive, unless things change in the future, in which case it could all change again. But at the time of sharing this with you, it's the way it is. But I'm going to start with a question, Ernesto. Why is it that I turn on the news, I look at the press and the media and social media, and some people are so adamant they're not going to get their vaccine? Why is that? I don't get it.
Yeah, I mean, well, we did some research and we find at least 6 reasons why people are not doing it. So the first one is that they are afraid that it's going to go wrong. Now, in my point of view, so far here in the United States, there's something like 130 million people that have been vaccinated. The entire country of Israel, the entire country of the United Arab Emirates. I mean, how many people have had the vaccination so far? I think that's enough to know that it's not going to be a big deal.
No, I don't know how many were vaccinated in this country. It's certainly at the point when I last looked, which was when I was just getting vaccinated myself. Israel was number 1 in the world for vaccinations per capita, and the UAE was a second. I don't think that's changed, but I don't know the actual number of what that is, because certainly the government just turned around and said, right, guys, it's free. Get in there and get vaccinated. Otherwise, things don't get better. And literally, we're all walking around with masks and social distancing. But Dubai is open for business, and it has been for about 8 to 9 months already. So I don't get it, but I get the fear of people thinking that. I think also there's the disbelief that whatever the virus does to you is dangerous. People turn around to me and say, oh, it's like a cold, you can shrug it off. How many people have you known that have passed? And we know the truth about it, and it's not a joke, and it is real, and it is brutal. And I really find it sort of disrespectful when people turn around and say, oh, it isn't anything. Might not be to you, but to many people, it is.
Yeah, it's insane. For me, the one that I think it's the biggest problem is the political allegiance. If you start looking around, and I think this is something that we're going to be covering a little bit further on, but it doesn't matter in which country you are in the world, you're going to get the political side or the political arm, which is okay with the vaccination. I'm not saying that they're pro, but they're okay with it. And then you're going to have the people which are not okay. So I think that's another reason why people are not really getting the vaccines.
I completely agree. And that goes down to the anti-vax beliefs, which we'll be looking at a little bit later on. But the amount of people, I mean, this is going back to like years ago, 5 years plus, where don't get flu, don't get measles vaccines. They make people have all sorts of brain diseases and problems and so on. And there may have been some evidence of it, but also we're talking tiny numbers. For people to turn around and say, I'm never going to have another vaccine, I'll naturally deal with it. And in many cases, turn around and say, well, my religion will protect me. And that happened a lot during the last year or so, usually by people who died of it.
Yeah.
So,
well,
I mean, it's a lot of reasons that make that happen. Another reason is what?
My mom died from COVID. And of course, I mean, I have tremendous respect. And I think that's another of those things that most people don't understand until they actually don't get it in front of them. They don't really get this seriously. So I think plain ignorance is just really big reasons of why things are not happening. And I tell you, I mean, I felt it in my own family. My mom died of COVID. And this is the reason why I have tremendous respect for it.
And you have to. And I would say, I mean, the list could go on forever, but ultimately, it's got to start from somewhere. It's usually my friend or somebody on TV or somebody who I know told me that. And people are buying other people's stories and they're bull without actually knowing themselves. Now, part of that is because there are a lot of stories floating about when you Google them. And part of it is because they're not actually doing a real spread of research. They're just looking from one particular source and they just say what that source is, must be always telling the truth. And I think it doesn't matter who you're with, there's always reasons behind. You need to do that research yourself and get a real spread of things before you make your own decision. Yeah. So that's kind of where I would say are the reasons why people don't take vaccines.
Yeah. And you know, another thing, which I think it's also very questionable for most people, and I think this is one of the reasons why we have to explain this in detail, Dave. It's how is it possible that of course, science managed to accelerate the creation of this vaccine? Because most people think, well, you know, it used to take such a long time and now suddenly they did it in 1 year. I mean, 1 year ago, we just got started with the Toilet Paper Diaries and we would have never expected that the vaccination was going to be ready by now. So how did that happen?
Well, I mean, they had to accelerate the whole process, and part of it is they had to make sure they all came together because you couldn't ignore it. There's a number of reasons why, but let's look at what the old kind of vaccines were, because there are 4 types of vaccines that we used to use. First of all was the ones that exposed you to a weakened or dead form of the existing virus, like the flu virus. So you get the cells inside you, your body goes, all right, fight it. And so you've got a level of resistance just in case a real thing comes along.
Yeah, and then we have also the vaccines that basically use an inert type of a toxin instead of a virus to make you immune to that specific disease. For example, this is the tetanus shot, which has been used for a number of years, and which actually it is incredibly important for in a number of different places. So that's another way of doing it.
And then we've got the types that took a little part of the actual of the virus. And they would stimulate you to go, right, if I can take that on, I can probably take all the rest of the stuff that comes with it. I mean, like the hepatitis B vaccine. So yeah, there's a couple of different ways that were used to take on a vaccine that people would react against.
So the whole thing was, and this is exactly the reason why everybody was very afraid, was because, of course, they were thinking in an old paradigm. I mean, either one of these 4 types of vaccines, it took a long time to develop. But I think what COVID has brought to us, I mean, it's the first time, if you think about it, it's the first time in present history or in these times that the entire world has been involved in this kind of thing. So right now, there's several things that have been done differently with the COVID vaccine. Possibly you can tell them a little bit why this was so innovative.
Yeah, absolutely. Because to turn it around in just over a year was just a phenomenal thing. We didn't expect, and the conversations were certainly it's going to be about 1.5 to 2 years before we even see a vaccine. And for those of us in lockdown, it was just the worst thing to ever hear. And we joked at first, it's only a couple of weeks, but then it became much more realistic. So what they did with this vaccine is, first of all, they started off with the first stage, which is discovering what it is and developing all the I would say the software, but all the details that they know about what's causing it, and developing some kind of vaccine that they can actually roll out, that they can use to move forward. But that doesn't mean that they've actually got something that's for definite. It just means they've developed a potential vaccine that they then have to do something with.
So if we go step by step, basically was the discovery and development that was the part that actually took the longest. So then, for example, if we go into the other ones, like the preclinical trials, the human trials, the licensing, the manufacturing, the distribution, if you think how long that will take, it will take forever. But the magic on what happened in this vaccine was that they overlapped everything. And that is just absolutely genius, because there were many countries. I mean, we knew that the Chinese were doing it, the Americans, the Germans, the Swiss, everybody was doing it. So what happened was that they managed to actually overlap many of these steps.
And I mean, even in the UAE, I remember when we had 15,000 people who were guinea pigs, who were all volunteers, who were being tested, all different nationalities, ages, and backgrounds, to be able to work out how effective the vaccines were. So, I mean, this is happening across the world. And the thing that made it really interesting as well is they removed politics from it. Certainly the vaccine companies removed politics, even removed pricing from it. It was just about, let's get something that works, let's get something that's safe. And that was a really brave thing done by everybody. Doesn't mean they wouldn't come around and charge later on, but they realized that there wouldn't be anyone left later on if it didn't go down that route. Because normally it takes 5 to 10 years to get an FDA approval, certainly in the United States. And by overlapping it, it means that the whole world came to play. And also it was something that it could have been any country that came up with the answer. And then it was kind of, they were willing to get that. But I do remember, and I won't go on about the political side, but I remember when we had a breakaway thing in Germany, when we said we've got a vaccine, and somebody who remained nameless said, let me buy all of them. I'll buy the company and take it all back to my country, yeah, and nobody else gets any. But let's not go there.
Yeah, well, right now, one of the things which they are discussing is that they want to make sure that the vaccine formula actually becomes public domain. And this is one of those discussions which are happening, because this, of course, is going to help the creation for everybody, especially for countries in Africa and for countries which are not really very, very wealthy. So anyway, what I think it was the biggest innovation, and it's actually absolutely fascinating, is that they didn't use, in most cases, any one of the 4 ways of actually creating the vaccine. Now, through technology and through the advancement of science, they started using something that is called mRNA. So possibly, Dave, well, we have a video to explain a little bit, but you can just pre-frame what this video is going to be about, and then we'll go to the video.
Well, we're going to watch a video about it in a moment, but the key elements are: research and development of a vaccine was accelerated by a new methodology, which is called mRNA, which is short for messenger RNA. Now, every cell has has DNA and protein, but the messenger RNA is a copy of the DNA. This sounds very complex. It is complex, but basically, imagine the coding and change the coding like a combination lock, and so they don't connect. And that's basically what happened. The DNA changed. The instructions about the cell were changed and was given to the protein so it would deal differently with anything that was approaching it, especially the coronavirus. So watch the video, it'll all be explained there.
Yeah. SARS-CoV-2 is a novel coronavirus that is responsible for the COVID-19 infection. The virus works by entering healthy human cells through the crown-shaped protein spikes on its surface. A promising candidate for the treatment of COVID-19 is a messenger RNA-based vaccine from Moderna Medical. Messenger RNA, or mRNA, are strands of genetic material similar to DNA that ribosomes in the cell use to synthesize proteins. Moderna's mRNA vaccine contains the instructions to synthesize the crown-shaped protein spikes on the surface of the SARS-CoV-2 virus. The vaccine is encapsulated into a lipid layer that allows it to enter the cell. Once inside the cell, the mRNA are released and ribosomes in the cell read them to synthesize the virus's spike proteins, which are then released from the cell. The spikes themselves are not harmful, but the human immune system perceives them as though the body has been infected with COVID-19. In response, the immune system produces antibodies against the SARS-CoV-2 virus. In the presence of an actual COVID-19 infection, these antibodies prevent the virus from entering a healthy cell by attaching themselves onto the spike proteins, thereby blocking their entry into the healthy cell and thus creating immunity.
I think it's fascinating. I mean, I honestly should feel very lucky that we are living in this future, because, I mean, this is something that before coronavirus, this would have been absolutely unthinkable. But the fact that everybody in the world was involved, that managed to create that. So I am a firm believer, because I have lost a very close person in my life because of COVID. I am a firm believer in science. And why is it so critical to actually get vaccinated? So the important thing on here is, why should we really believe in science and get vaccinated?
Well, I mean, a lot of people are still going to argue this, and this is a big problem we're going to be talking about later on. But ultimately, what happens is a virus itself is like people. It wants to survive, it wants to spread, it wants to evolve, it wants to stay alive. And it has a very different way of doing it. Same as we spread like a virus across planet Earth, starting originally in Africa many, many, many moons ago. What happens is the virus wants to reproduce, and the way it does that is it forces you to spit and cough. And when you do that, you spread the germs. And if it doesn't do that and it stays on a single host, eventually it'll die. And so then what happens is it spreads it to other people, and then it becomes able to evolve and grow. Because if you don't spread it, or you do get it onto enough people with a vaccine, then you can create herd immunity, which means that ultimately the vaccine has nowhere else to go, because the coronavirus has nowhere else to go, because the vaccine will kill all the elements that allow it to connect to new people.
So I think one of the most important things that we need to get into consideration is that the goal of the virus is not to kill the host. And I think that's one of those things that people get very confused. So the goal of the virus is not to kill the host. It's to reproduce itself. I mean, think about it in these terms. I mean, I think it will be the equivalent for the virus for us having sex. That's how we reproduce.
Not you and me having sex, no. People generally having sex. Right. Thank you, Ernesto. Just before you start getting ideas, I know I'm a good-looking guy, but just stop it there. But yeah, you're absolutely right. I mean, that's what it's doing. The side effect is that hosts die, but not all the hosts die. Otherwise, it would be a completely different experience. It's not trying to kill everybody. It's just trying to grow longer. But sometimes for certain people, they do pass.
So that is exactly the point. I mean, so the point is not, well, I don't want to get the vaccine, because if I get the vaccine, I am more afraid of the vaccine of this. The point of the freaking virus is that it's going to be reproducing itself. So if we create that herd immunity, we stop the reproduction. So basically what we're trying to do is basically chop the balls off the freaking virus.
But other Toilet parts are available. Right then. So here's a question for you, Ernesto. Why doesn't the government or all governments just turn around to their people and say, right, you must be vaccinated, because then we will just get herd immunity and we'll stop the virus spreading?
Yeah, well, because of course, I mean, it become incredibly political. I mean, we see it in countries like Mexico, that the president is saying that there's no issues with it and everything is perfectly fine. And it just becomes incredibly political. So I think what is going to happen is that the private sector will actually do it. And this is a very interesting thing. Well, let's just think about it. For example, in the airline industry, most airlines are going to say, well, you cannot travel. You cannot travel unless you have a certificate that you have been vaccinated. It's the same thing in borders. The moment that you arrive in some countries, they're going to ask you that you need a stamp so that you don't have yellow fever. Or for example, if you go to Saudi Arabia during the times of the Hajj, you need to have the measles, and it's going to be exactly. So you need to have that. Prescription, exactly the same thing. Cruise ships will not let you get into the cruise ship. Universities right now, if your kids want to go to school, they're going to be asking them for vaccination. So it's not a different thing. It's not that they're forcing you to do it. But what happens is every single private entity will make it happen. Will ask for these kind of things. Concert, public events, anything where there's going to be big gatherings is going to be doing this, requiring.
Well, yes and no, because the thing is, as you've experienced going to a baseball match, what they decided to do was go down the neutral political route. If you don't want to wear a mask, if you don't want to get vaccinated, there's an enclosure, which is called the Petri dish, where it can just basically infect everybody. Or if you don't want to do it that way, you want to wear a mask and social distance, then we have an enclosure for you.
Yeah. So once again, I mean, they are trying to play the political game. So if we think about it, I mean, no question about it. This story about the coronavirus, it's a political issue. It's absolutely political. So that's why they don't want to go into the other, and they're actually letting the private sector actually go for it. So I have here a short little video from PBS that talks about what's happening with one specific sector of the population and the hesitancy of getting the vaccination. Have a look.
Nearly 41 million Americans are now fully vaccinated. But as many polls show, including our recent PBS NewsHour NPR Marist poll, one segment of the population remains steadfast in their opposition to getting a vaccine: Republicans. Yamiche Alcindor reports on the role that politics is playing in the effort to vaccinate America.
Across the country, vaccinations are ramping up. But a new public health challenge has emerged, persuading millions of Republicans to get the shot.
I'm just not ready right now to jump in my car, run out, go to my doctor or wherever I have to go and get that vaccine.
65-year-old Michael Carr lives in Tulsa, Oklahoma. He's a supporter of former President Donald Trump. And while he's eligible to receive the vaccine, he's still not sure if he will.
What's the hesitancy there?
I've never had the flu vaccine. I'm 65 years old. Probably should be getting the flu vaccine, but I don't. Am I chancing it? Yeah, probably. But I just have never taken the vaccine before, didn't really see the need for it. I'm kind of in that same boat with COVID-19.
Carr is not alone. According to a recent PBS NewsHour NPR Marist poll, 41% of all Republicans say they won't get a COVID-19 vaccine. That makes them the most vaccine-hesitant demographic in the nation.
Interesting, but here's the thing that most people don't seem to get when they don't want to wear a mask and they don't want to get the vaccine and they don't want to do the social distancing. It's not about you catching it, it's about you spreading it to other people. So you are not only thinking about protecting yourself and whether you make a decision of living or dying and taking a risk, it's whether other people around you can catch it. We know people who've passed who didn't go out, but their kids did, and they came back and brought it in. So there's more to it than just what happens to you.
Yeah. On this second clip, I love what is happening because there's a virtual Zoom focus group with people which are hesitant of having the vaccine and the political ramifications of what's happening. So let's have a look.
My fear of the vaccine is more than my fear of getting the illness.
Last weekend, longtime GOP strategist Frank Luntz conducted a virtual focus group with 19 vaccine-hesitant Republicans from around the country. Michael Carr was one of them.
When I say COVID-19 vaccine, Adam, what do you think of first?
A miracle, albeit suspicious.
Rushed.
Long-term side effects unknown.
Uncertainty.
Untrustworthy.
Luntz worked with the Beaumont Foundation, a public health nonprofit, to create pro-vaccine messaging aimed at conservatives.
This is 35 million people. How are we going to get our country into this herd immunity if 35 million people won't take the vaccine for political reasons or partisan reasons or Washington reasons? And the amazing thing is, it's probably Donald Trump's greatest success of his administration, the speed by which these vaccines were developed. And yet it's his own people, the people who voted for him, that are most hesitant to take it. Who'd have thought?
President Trump was vaccinated against COVID-19 before leaving the White House, but he chose not to do so in public.
It's important for our fellow citizens to get vaccinated.
And he was noticeably absent from a recent ad featuring other former presidents who called on Americans to get vaccinated. After mostly dodging the issue, earlier this week he appeared on Fox News and said this.
I would recommend it to a lot of people that don't want to get it, and a lot of those people voted for me, frankly. But, you know, again, we have our freedoms and we have to live by that, and I agree with that also.
Being against vaccines has been seen now as a badge or as a sign of loyalty to the Republican Party.
Dr. Peter Hotez is the co-director of the Center for Vaccine Development at Texas Children's Hospital. He says anti-vaccine sentiments already existed in the fringes of both the Democratic and Republican parties. But in recent years, this movement has resonated most with conservatives who are skeptical of the government.
It's strange then. You end up with a situation where we have to give, kudos where it's due, that Trump, when he was in power, did work hard on Operation, what was it? Operation?
Faster Speed or Lightning Speed or something like that, no?
Yes, Operation Warp Speed.
To
bring out the vaccines. But you end up with him being one of the people that said, don't wear a mask, don't social distance. And that Trump call, effectively trumpet call, is why many people of his party still don't want to get vaccinated. And it's kind of weird that you produce it, but then you don't use it. It doesn't make sense to me, but it's not meant to make sense to me, I guess.
Yeah, well, I think that's one of the issues why a lot of people are very confused. But if you think about it, I mean, I don't know if you remember where all these things originated. I think it was one of the first debates when they were debating in front of that aircraft in the Reagan library, where Trump started talking about this kid that got vaccinated and suddenly he became autistic. And from the very beginning, he was not too much into vaccinations. You remember?
I didn't see it because I live in Dubai and I very rarely watch TV, so I wouldn't see it anyway. But I think that it kind of goes back further. We mentioned earlier about the huge debates about measles and about flu vaccinations that happened before Trump was really on the scene. And that's been a debate for ages. But the thing about that was it was like both sides. Is Republicans and Democrats were people who were saying don't take vaccines for whatever reason that was. It certainly wasn't used as a political football as it has been, and it's still continuing to be.
Yeah, I think it's just absolutely crazy. So now what is happening is that there's an anti-science platform. And on top of that, we have the conspiracy theorists, which are amplified by the conservative media, which is just insane. I mean, just look at this clip of Tucker Carlson questioning the vaccine. I mean, it's just really weird.
The question is, how effective is this coronavirus vaccine? How necessary is it to take the vaccine? Don't dismiss those questions from anti-vaxxers.
But the challenge for the Biden administration is preventing that message from spreading. This week, the president called on local leaders to help in that effort.
I urge all local docs and ministers and priests to talk about why it's important to get that vaccine, and even after that, until everyone is, in fact, vaccinated to wear this mask.
We're very glad that you've decided to join us.
Religious leaders like Seth Nelson, a Lutheran pastor in the rural community of Ronan, Montana. He was vaccinated in early January and has been encouraging his congregation to do so as well.
A number one concern I'm hearing from church members who don't want to get the vaccine is that there still is a lot of unknowns with how quickly it came to be implemented and distributed. And I think for some folks who've been, felt forced to wear masks and distance and shut down and all that stuff, I kind of get the sense that some of them resisting taking the vaccine is as much about them being able to kind of control something in a very uncontrolled situation.
So there we go. Look, if you just joined us, welcome to the Toilet Paper Diaries. The whole point in this is it's a survival guide to understand the ins and the outs, ups and downs, and the truth about the COVID vaccine. That's what it's all about. So, because there's so many different messages, confusing, making people hesitate, and ultimately we want you to get safe, but we want you to understand exactly why you're hearing so many different things going on. I mean, for you, Ernesto, was there any point where you felt that you didn't want to get vaccinated?
I mean, I was ready to go into the trials. I mean, because there were several offers that they were offering $700 if you wanted to be a guinea pig. And I was happy to do it, but my wife told me no, and my mom told me no. But I was happy to do it.
I did have a level of hesitation about what if it goes wrong. But then I thought, well, what if it goes right? All the headaches and all the worry and all the fear and all the loneliness and desperation that I would feel because of being stuck in isolation, I could leave home and know that whatever happens, I can connect again and start moving again. So for me, it was a no-brainer.
I mean, in my eyes, for me, I connected the dots right away. In my mind, I was clear what I wanted to do. Now, what I think people are hesitant is because they have not connected the dots. I mean, and if we see that at this point, conservative or Republicans in this country are the ones which are hesitating the most, the story is not to attack them and not to try to convince them and force them through their throat, but basically try to help them understand in ways that for them it will be a way to see things in another way. So in my case, for example, the Republicans are big on safety and guns and these kind of things. I think the vaccine, it's safety for themselves and for others. It's not only about for yourself, but also that it's for others. And I think that's just something that it might resonate with them. It's also...
What you're talking about is reframing it.
Reframing it. That's exactly what I want to say.
Mindset would allow them to accept it, whereas the way they looked at it before, they were against it. So think about the vaccine as a gun against COVID.
Yeah. Exactly. So you're defending yourself. It's personal responsibility, and things are going to be a lot better when you see it that way. In fact, this clip is also very interesting in how they put everything into perspective. I hope it's useful.
I probably need to just separate my reaction to the government involvement in this and look at just the science.
Frank Luntz says the same effort is also needed to convince Trump supporters to take the vaccine.
Republicans believe in personal responsibility. Well, what is more personally responsible than to take a vaccine that'll not only keep you safe, it'll keep your family safe, your neighborhood safe, your friends safe, and they've got to connect the dots.
Back in Oklahoma, that's a message that seemed to resonate with Michael Carr.
I would say now I'm leaning a little more towards being open to getting the vaccine. But again, I want it to be my decision. I want to be educated, not coerced.
It's fascinating. Now, here's the thing. We want to put this whole show together to give you choice, but ultimately to get more people to realize when they're armed with enough information that they really need to get vaccinated in order to do this herd immunity. In fact, we're going to share with you 10 amazing reasons why you need to do it.
Yeah, we have really dedicated a lot of time putting this show together. So please, if you're finding value out of it, give us a like, give us a comment. Let us know where you are on this debate, if it is a good thing, if it is a bad thing. Make sure to share it. We need to make sure that people get this message because most people don't. And the faster that this happens, the faster that we can go into the normal life that we were used to.
Absolutely. I'd say the second thing then is if we don't get the vaccinations out and we get people using it, then we end up not reaching our herd immunity, which I believe is about 70% of the country, any given country, has to be immunized. And then it's really hard if you don't get to that number to be able to make sure that you can plan for the future, going on holiday, changing your work, going out and meeting people, having relationships like we used to have before. If you don't have that, you won't be able to move forward, and we have to stay in this kind of weird limbo, which none of us find really comfortable.
Yeah. Number 3, it's just think about it. It just takes an outbreak for us to go back into lockdown. And this is just incredibly important. I mean, right now, for example, I saw the pool parties are opening again in Las Vegas. And I saw that the Texas Rangers suddenly decided to fill up the stadium to capacity. All it takes is one outbreak and everything goes back to where we were.
Let me rephrase that. It's not an outbreak, it's a spike. We've already got an outbreak.
Yeah.
It's a spike. It goes up and down like that. We want it to keep going down. But if it spikes again, the only way to fix it and to help people is to say game over. And then we go back. It's like playing Monopoly and going back into jail again.
Yeah.
Do not pass go. Don't collect $200. Go back to jail and then miss a turn. And then we'll start it all again. Well, I've missed enough turns. And for me, it's a no-brainer. I would say number 4, by the way, is getting the vaccine will also protect you and your family from getting sick. Once you've got it, then you can connect with people. You might have got an extended bubble of people in your family, or you might have got together with another family or a couple of people, and you've had your time together. Certainly for your kids, it's important that they do connect. And for us as adults, it's important as well. But the faster that everyone gets the vaccine, the more you know that people aren't going to get sick. And so you can go to work and you can get things done and go to school as well.
Absolutely. Number 5, mRNA vaccines are very safe. We've seen you and we've shown you exactly why it is a lot faster to create these vaccinations. They are not injecting you anything that is going to be affecting you. It's just basically a protein which is going to help the DNA know what to do if you get the virus. So they are safe.
Well, I would say that with that in mind, not only the safety is important, number 6, I'd say getting vaccinated allows you to have more freedom to go to other places. And when we talk about other places, we're not just talking about going to the shops. We're talking about the travel that goes on to it, about the ability to go on that holiday you've been waiting to go on for about a year and a half, the ability to go and visit people who are older or would maybe be, high risk. If you want to go out and go and connect and start that travel again, which let's face it, most of us hadn't done during a lockdown experience, you can only do it with one way to know about it. But it's like you're not going to affect anybody and they're not going to affect you or pass it on to somebody else through you. That means you've got to get vaccinated. From my experience, by the way, number 7, I'd say that side effects that I had was I was a little bit sluggish for about a day, but that was it. It only lasted for about a day. I felt a little bit tired, fell asleep in my chair while typing, which is usual for me. But after that, it was gone. And if anything, I think the mental strain that disappeared gave me more life and energy as soon as I knew that it was working towards a better me.
Yeah, I was a little bit tired for a couple of days, and I had a little bit of pain in my arm. But besides that, I mean, those were the only things. My wife also felt a little bit bad after the second vaccination, the second Pfizer vaccination. She sort of, she felt awkward. I mean, she had a little bit of fever or whatever. But this is a good thing. Whenever you have a side effect, especially on the second vaccine, it means that it's actually working.
Yeah.
So.
Absolutely. And also, when I went along, they said to me, have you got any allergies? And I've got a slight seafood allergy if I eat shrimp or anything like that, shellfish. I tend to find that my throat sort of heals up. But with this case, I said, oh no, you should be fine with that. And so if you have got allergies, and you are worried about it, you should still get the vaccine. Double check it when you get there, because they'll tell you a list of things that you should be careful of. But pretty much have decided that allergies are not a reason for you not to have the vaccine.
Yeah. Number 9, and this one might seem obvious, but obviously it's not as obvious as you think. Vaccines don't work unless you actually get vaccinated. I mean, what I want you to think about is we are in a global pandemic. I mean, this COVID lockdown has affected the entire planet. The entire planet. Not getting the vaccine and not doing everything possible so that we can just close the gap is going to help this stupid virus to keep on reproducing itself. Remember, the goal of the virus is not to kill the host. This is a critical thing that you need to get into consideration. It's to reproduce itself. The way that we can stop reproducing that virus is to basically cut the balls of the stupid virus and taking away the possibility of getting into the other hosts. And that's the whole point. It's not about you getting sick. It's about stopping the stupid virus. And that's the important thing.
I wish you'd stop talking about cutting balls off as we go into the final thing, which is number 10. I can still feel it, and it's never happened. But I do worry when I sleep at night, especially after an argument with the wife. Number 10 is time is of the essence before the strain evolves. And it's not only just the strain evolving, because as it mutates and all the hard work that's gone into the vaccines means you haven't got the full protection because it wasn't designed for the new mutated virus. It was there for the original virus. And that's what all the testing went on for. Goodness knows how long it will take to do this, the next version of it. And that's what a big challenge is. But it's not just of the essence about the evolution of the virus. It's also because of the economic challenges that the world's facing. If we want to get back to business and we make sure there's no global recession worse than we're already going through right now, we have to get back into business. And that only happens when we feel safe and we're up and at 'em again. So get that get that vaccine and don't get the virus.
Yeah. In essence, I mean, this pandemic has changed the world in ways we would have never expected. There's no way that everything that has happened, some of them are going to come back to what they were before. Some of them are never going to come back to what they were before. And it is just absolutely critical that we do everything possible to instruct people and get people educated on these kind of things. Once again, what we need to make sure is that we stop this virus. And the more that we get people immune with immunity, with artificial immunity, which in this case is the vaccine, it's going to be the better. So if you have liked this show, please make sure to share it with people. Please make sure to give us a like, give us a comment. The more you share and the more you comment with people, the more that the gods of the YouTube algorithm are going to help us spread this message. I think Dave and I have done a ton of work in putting all this information in a nice, fun way. But I think it's also super important. So I hope that you have enjoyed this episode.
Well, we've done the heavy lifting. All you have to do is watch it and share it with other people and make sure you stay healthy, stay safe, and get vaccinated. That's it from us. Look after yourself, and we'll be back again soon with another episode of the Toilet Paper Diaries. Take care.
Bye-bye.
We got to get vaccinated, get this country back going. And I'm happy I am. For those who haven't been vaccinated, it's a liberating feeling.